All right, well, welcome everyone. Thank you for having me. The presentation I'm giving today is short and sweet and is supposed to leave you here with a little bit of what's next. How can I implement this in all different ages and populations? So striving to optimize your physical health is kind of the name of the presentation, but we're really going to dive into there you go. Awesome. So we stand here. So in the healthcare world, every year we have routine screens. If you think about what you have to do on your list every year, you have your medical and dental. That's common practice. We start dental basically when you're about 1 year old, just going to see the doctor, the dentist to get used to them. And we start our medical screens almost at month 1 or even day 3 after birth, and we go every year and sometimes even more than that. That's common. We do that, we don't ask questions, we just go. But the 2 points of why we do it is right here. Assessing your overall health and prevention. So every year when you go to your doctor, whether you're healthy or not, they're going to see what's going on, what could be brewing, and they try to check for things that you might not have symptoms for, but you can prevent. Big ones are blood work is what they order usually, especially when you get a little older. And when I mean a little older, probably over the age of 23 is when they really start taking blood work. And they're looking for precursors of heart disease. Diabetes is a big one as well. They look at your weight, they look at your BMI, they even look at your skin a little bit, and then they talk to you about any other issues you have going on. But in the words of prevention, in the medical world, you know, they're trying to catch things before they get worse. And what happens with this is once you start becoming symptomatic, it's a lot harder to treat. So if we catch it earlier on, it's easier to do. Same with dental. We're looking for cavities, we're looking for gum disease, gingivitis, we're looking for breakdown in different areas, even jaw pain. So this is common nature to us. So I bring that up because yearly, we see the doctor once, hopefully. We see a dentist twice, maybe 3 times if our insurance will pay for it. We see our vision, get our eyes checked once a year as well. Women, gynecological exams after a certain year, every year, or even more if needed. Psychologist, if you have any other issues going on, that's usually an annual checkup as well too. And hearing, which I know for myself, I don't go every 10 years, but I know I probably need to start. My wife says that I don't hear her. I don't know if that's an auditory issue or another issue, but then over the age 50, they recommend every 3 years. But what about our physical health? And in the role of what I do, I'm a physical therapist. Why are we not doing annual musculoskeletal physical exams? Now, I do recognize that some primary care doctors do some type of simple routine exam, and I don't negate what they do. But our health is very important to us. And when we look at the statistics out there, and the research from this study, this is a groundbreaking study in 2011, it's only gotten more serious. But if we look at the 4 most factors that people suffer from, number 1 in the country is chronic pain. 100 million Americans deal with that. And number 2 factor, diabetes. Number 3, coronary artery and heart disease. Number 4, stroke. And number 5, cancer. So in all our routine wellness checkups that we go to, they're screening for diabetes. They're screening for heart disease, precursors to stroke, as well as cancer. But how are they screening for chronic pain? Now, we're good at treating the bottom 4. There's medicine, there's lifestyle recommendations, there's surgical interventions for those 4, but we're really not good at treating chronic pain. We're actually terrible at it. Now, the problem with this and why I bring it up is chronic pain is expensive. It's expensive because when you're hurting, you can't do what you need to do nor want to do. You lose time at work. It costs the employer more, it might cost you more. Doctor's visits, medications, etc. It gets very, very expensive. So what if we're screening for this? And right now in the world we live in, there are some different physical therapists, chiropractors, and osteopaths that have been promoting an annual checkup, an annual screen. And we'll go into that a little bit more in the slides. But what we're trying to do and what we're recommending to all people of almost all ages, and I would say all ages meaning teenagers and past. You know, a 4-year-old coming in, we don't need to do a bone flexibility check, they're growing. But as So in ages, we definitely want to see how they're moving. What we do is we check vitals. We check their general range of motion, general strength and endurance. We check cardiovascular endurance. A lot of things we talk about is their exercise habits. So depending if they're 18 years old or 98 years old, what are you doing? We also check their work ergonomics. How are you set up at your computer? Are you doing a manual labor job? Are you on the phone all day? How are you holding your phone or using a headset? And lastly, we ask 3 questions that a lot of people don't ask. Sleep hygiene. Not just how many hours of sleep, but is it that good quality sleep? The other part is stress management. How are you dealing with stress? Hopefully you're saying you're working out, you're meditating. I even like to tell people to go color. Adult coloring books really work, believe it or not. Markers too. And the other thing is recovery. So let's say you like to play pickleball or golf or run or CrossFit or whatnot. How are you recovering from the stresses you're putting on your body? And we help to guide patients and individuals to recover from what they're doing. Now, in the preventative aspect, there are 4 or 5 major things that we could help prevent. The one thing that we have tons of great literature on is preventing hamstring strains in youth, adults, and geriatrics. We can't prevent ACL tears. We know that's very common in your younger and middle-aged athletes, but we can come up with different strategies to mitigate risk, to decrease risk of tearing your ACL, but we can prevent. What we can do is we can help prevent low back and neck pain, and we can definitely help to prevent falls. So I want to start off with all of us in the room or on Zoom. I'd like everyone to sit up nice and tall. You don't have to stand up. And I'd like everyone to try to turn their head as far as they can to the right and then to the left. So the first question I ask you is more hypothetically, is 1, do you feel tightness? 2, do you feel pain, which I'm hoping you don't? 3, if there was someone behind you with their hand up that had a certain amount of fingers, can you turn around and see how many fingers they have without rotating your whole body? Well, if you said pain, tight, or you can't see around yet, there's 2.5 times more likely that you might be getting into a car accident. Yes, there's literature from 2004 and 1994 and recent studies that show that limited neck rotation can be a precursor to accidents. So if you have limited neck motion in rotation, there's a 2.5 chance that you'll be getting to an at-fault car accident. Now, does that really matter right now? No, but if we catch that earlier on, we could show you what stretches to do or make you aware of it, or even what exercises that you need to do to help improve that motion to prevent it. Now, there's tons of articles there that compare posture or poor posture to neck pain. And I have to say it, there is no direct correlation to having really terrible posture and getting neck pain. But that doesn't mean I'm going to tell you to slouch all day. But if you are having neck pain or you are having back pain and you're on your computer all day down low, if you're slouched at a computer all day or on your cell phone, changing your posture when you're already having pain can be a primary way to help alleviate that, but also can help improve your efficiency at work and not have to deal with that. So I'll repeat that again. If you slouch all day, it's not a terrible thing. But if you're slouching all day and you hurt, that is a problem. So in our screens, we look for this. We ask you questions. We also make recommendations of, hey, bring your computer a little bit higher, bring your keyboard a little higher, your mouse that might be like so. We might ask you to use a vertical mouse. Have you guys seen those before? It's a
vertical mouse?
Yes, the common mouse that's horizontal that goes like so.
Right.
Causes a little bit of shoulder internal rotation and forearm pronation. It can be a precursor to carpal tunnel syndrome. So anyone that's having any carpal tunnel-like symptoms, neck pain or arm pain, for $20 on that fancy site called Amazon, you could buy a mouse that literally turns your hand this way and has full control.
What's it called?
A vertical or inverted mouse on Amazon. $19.99. By the way, I don't have any stake in the game. I wish I did. But the point of saying that is a small correction with a low cost can make some changes. So next is shoulder motion. So again, I ask everyone to sit up nice and tall. I ask you to take your right arm and raise it up as high as you can, pushing through the tightness of your shirt if it's tucked in, and then down. I ask you to raise up your left arm, bring it all up. Oh, look, everyone's doing that. We got Nick and Kaylee and Maggie. Very good. And back down, and we ask to raise both arms up. So if you have any tightness, where you put it, if you have
That was
any,
great, by the way.
if you have any tightness in shoulder motion overhead, any pain or any limitation, there's a good chance that's going to impact you with overhead activities. Now, I correlated directly with recreational activities because there is a correlation with limited overhead elevation, meaning raise your arm all the way up. And it doesn't mean that you have to hurt. It just means it has to be tight or limited. And what happens is most of the time we go, it doesn't hurt, so why do I need to see a doctor? I just deal with it. I just know that I can't go all the way up. Well, the challenge is if you want to get back to a throwing or overhead sport, it's going to change the way you throw. It's going to change the way you serve. It's going to change the way you move. Also, we do screens to watch how you do combined motions. One meaning how you reach behind your back. One, how you reach behind your back as well. And one, how you reach across. Now, those three motions are very common. For men, they're tucking in your shirt. For women, they're putting on your bra behind your back. For here, it's kind of washing yourself and the infamous take the shirt over the head motion. And then the last one is reaching across your body, which could be to put on deodorant or shave your armpit or whatnot. But what we do in our screens is we see, well, one, if it hurts, we know it's a problem, but what if it's tight and limited and you're compensating? Where a lot of people say, well, I just spin my bra from the front to the back, or men, well, I just put my belt on before I put on my pants. There's always compensation. We do. Well, this is what, again, us medical professionals, including PTs, chiropractors, and osteopaths, we do with our patients and clients. So again, think about this. Now this is the fun part. So looking at the literature for risk of falls, and the gentleman, Tenetti, he has this balance scale that's very long in length, which I don't feel like we need to go over, but in the research that they did, there's 4 factors that lead to high risk for falls. And one of them is obvious. The more medications you're on, the bigger chance of fall. So we have to keep that in mind. And that's something that a lot of times we don't have control over because they might need to be on an anti-anxiety drug, a blood pressure medication, a heart medication, and something else. But there are some that we can affect, and those are the next. So if your client or patient says, I have difficulty getting up from a toilet, there's a large chance that they're at risk for falls. That could be due to limited motion, decreased strength in your hips and quads, but there's a correlation between them. The next one is difficulty walking. Well, that's obvious. If you have difficulty walking, there's probably a balance issue, whether it's pain or equilibrium or whatnot. But the one test that we could do very easily, and that's why I'm going to ask everyone to stand up for a second. Those Zoomers, if you'd like to stand up as well. If you think you're going to fall, have something around you. I don't have malpractice insurance for what I'm doing right now, but please, we're all going to stand on our right leg. And we're going to count to 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and repeat on the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And it looks like everyone in this room and in Zoom did well. Little wobbles here and there, but that's not an issue. But these tests are more for your over 55 population, not 55, but way over. And if you can't stand on your leg for 10 seconds without holding on, it is basically a 46% chance that you're at risk for falls. So it just means that we could help screen for this and implement strategies to help prevent a fall. Now, a fall could be as simple as a black and blue, but could be as complex as a hip fracture, a lumbar fracture, which again, keeps you away from what you want to do, does not keep you active, and is very costly in the healthcare system. So again, with the word preventative. Of course, we're going to move again. So pop on up again, up and down, up and down. So the next 2 things is forward bending. So in any which way you'd like to, bend toward your toes. And come on back up. So the big question that we ask is, do you feel tightness in your hamstrings or any low back pain or any tightness in your back? If you felt any tightness in any of those areas, it can result in increased risk for low back pain or hip pain, especially with golf. They found significant limitations in forward bending and hip rotation. Hip rotation meaning sitting with your legs crossed and external, or sitting with your legs crossed and internal, can result in limitations with golfing and rotation-related sports. Also, there is a huge correlation to back pain and hamstring tightness and how they go hand in hand. So we could address that, implement the correct strategies of strengthening and stretching, and help prevent unneeded injuries. And the big injury that you see with people is my hamstrings are always tight, and then all of a sudden, I bent over to pick up X from the ground and my back went out. And the scary thing with that is, I bent over 100 times to pick that up. But this time, on this day, at this hour, my back went out. And it was kind of the straw that broke the camel's back. So we tried to catch this earlier on to prevent backs going out on people. Only a couple more slides. You guys can have a seat. No more standing up, I promise. So the next thing in a lot of sports that require reaction, moving quickly, is tennis, pickleball, paddle, as well as skiing. They're not slow sports. You're constantly moving. And with this, there's certain tests, and one is called the alternate foot tap test, and it measures reaction time. They implemented this test for the elderly population in driving, where what they did was they put a binder against the wall, and with your right foot, you have to step over the binder. You're sitting down, you step over the binder and tap, and back to where you were. And you do that 10 times. It's basically the ability to move your right foot from the gas to the brake 10 times. And they measure how fast you could do that. And they found that if it took someone more than almost 8 seconds, they were at high risk for car accidents. So they took this study and basically they looked at an active, more healthier population and standing up, putting a cup on the ground, stepping your foot over, you should be able to do 10 times less than 8 seconds. And if not, this could lead to injury with quick movements or lead to possible car accidents as well too. So it's a simple test that we could do to check people's reaction time. And then the last two parts, I'm just going to talk a little bit about hamstring screening and ACLs. So hamstring issues are one of the most common strain muscles. Like the gastroc is a very common, the gastroc is a very common one, the calf, but hamstrings are. And this is the most common person is, I want to get in shape. So I'm going to get out there and start walking or jogging. But their body hasn't been used to that for a very long time due to sedentary activity, blame COVID and the pandemic, or whatever reason. So they get up and they put a plyometric force on their body, which is jogging, and their hamstring muscle says, no way, I'm not ready. So they might get a cramp, they might get a spasm, or they might even get a small strain, which is a minor tear. So we found that screening for hamstring issues, we're looking for these factors. One, if you have a history of low back pain, there's almost a 19% chance that you'll strain your hamstring. If you have a history of groin injury, there's a 15% chance. With the adductors, the groin muscles and the hamstrings go hand in hand. If you had a previous hamstring issue, there's almost a 5 times chance that you're going to have it again. That's like low back pain. If you had low back pain once in your life, you're definitely going to get it again. That's almost 90% of the population. And then also we look at muscle weaknesses of your hip and knee muscles. If you found that some of your hip muscles and knee muscles are weak, that could be a precursor for this. And then again, flexibility, how you're warming up, and report of cramping and fatigue, which usually goes in it with diet, nutrition, sleep, and salt intake. And basically, hamstring prevention is warming up, flexibility, and strengthening. Fancy way of saying you want your muscles getting ready to go. You want to make sure your muscles are strong enough to engage in the activities you want to do. And you want to make sure that your muscles have the appropriate length, so stretching is a very important part as well. So we could create the right program for you, where a 15-year-old athlete might have a different program than an 83-year-old athlete. A woman who is pregnant might have a different routine than a woman who is not pregnant, depending on what their goals are. And same for men with different issues too. And the last part is ACL tears. This is the most common injury in high school and collegiate athletes. It affects women a lot more than men. There's more research on this injury than any other injury in the world. And guess what? We cannot prevent this. It's impossible. We look at strength of different muscles. We look at how people jump. We look at how they land. We look how they warm up. And there's no good way to prevent it, but there are strategies to decrease the risk of it. So what they find is the major sports that you'll see this in is basketball and soccer. And the injuries are not always contact injuries. You always think that maybe the athlete get hit from the side, but a lot of times it's the athlete steps the wrong way and pivots. And it usually looks like this. It's a step, cross, the cleat gets stuck in the turf or whatnot, and then you get what's called a hyperextension rotation injury, and they hear a pop, a non-contact injury. Now, these injuries are rough because they usually result in surgery. Rehab time, if you're not Adrian Peterson, is about a year. If you're Adrian Peterson, it's about 3 to 4 months. But it's a lot of time away from sport. It's a lot of time laid up. It's a lot of cost in the healthcare system. They're not easy things to rehab. So some things that we could do in our annual screens is we look at the quad muscle bulk. If we look at the quad muscle bulk and they're about even, that's a real good thing. We could do strength tests of the quad, which again, using a special strength testing machine that's very inexpensive, we can see the true difference between one and the other. We could watch how the athlete lands when they're jumping. For example, when they jump, we want them to land comfortably like so, where a lot of times if they land in a dynamic movement with their legs falling in there, that's a high risk factor for ACL tear. And then the last one is basically when they squat and when they do dynamic movements, what do their hips and knees look like? If we check for this and they have a couple positives, it's a great way we give them the correct exercises to prevent this or decrease risk. So overall, how do we mitigate risk for ACLs? And again, for this, I would say more your 13-year-old to like your 25-year-old is the major category, is single leg exercises, jumping, pivoting, strengthening, flexibility, and reaction times. And that's something that's a little beyond what we in the room need, but think about your kids, your cousins, your nephews, and people that you associate with. And then the last thing is not all exercise is equal. To just get up and start working out, to go online and Google a program, to read a blog, that's good. There's nothing wrong with that. But you really need something customized to you for certain purposes, because everyone needs to be treated individually. So I mentioned that self-guided exercise programs, that's kind of like your Google search and you're reading your blogs and your general information on the internet, that works. But sometimes going one step further is going to increase the effectiveness of what you're doing. So we're not saying that you need to come to us for 10, 12, 15 visits. An annual screen that might lead to a recommendation that visit, and then you follow up as needed, could be one answer. An annual screen that may lead into a few sessions for us to give you the tools to help you is what usually happens. So think of it as like a one-time annual exam with some recommendations with maybe a once-a-week follow-up for a couple weeks. And not all exercise programs are the same. So the type of exercise that we impart is many different types. For all people from ages, I'd say teenage and all the way up, we come up with what we believe you need. Is it cardiovascular endurance? Is it flexibility? Is it strength endurance? Is it a jumping reaction exercise? Do we believe that yoga, Pilates, Tai Chi is what you need? Is powerlifting what we need to add in your program? There's certain routines that we come up with for chronic persistent pain. There's certain things that we could recommend for weight loss, but usually it's a combination of many, and we put together that program for you. So your musculoskeletal health is very important. We recommend that you consider having a yearly exam. We basically want to set up your yearly fitness goals. We want to prevent things that may be occurring. But when I do these, it's very simple. It might be as simple as, hey, I'm just checking in with you. And I might actually tell my patient, you look great. I wouldn't change anything you do. I'll see you in a year. Or, hey, it looks like these areas are getting a little tight and stiff. Here's a couple exercises to work on that. And I think you're slacking a little bit on your diet and your exercise dedication. We need to bump that up. Or, I didn't realize you had this limitation in your neck or shoulder. I think it's something that here's a couple stretches. If it doesn't work, come on in, we'll formally treat it. But let's catch it now before it leads to something. Now, how do I get started? The who is PTs, chiros, and different osteopaths. The how long does this take? 30 minutes to 60 minutes, depending on how they like to structure it. When should I do this? We recommend that if you've never seen us before, see your primary care doctor first, and then come see us. Make sure any medical red flags are ruled out before you come see us. So that's one aspect to talk about. And what does it cost? So what we usually do is we bill you for an evaluation. Most insurances cover it. If we've seen you before, we bill you for a reevaluation. If it's something that your insurance, well, they usually cover both of those. But for example, for some people, they just pay out of pocket. It might be a small fee to come see us for an hour session to do a screen. And sometimes we might even do this for free. And that's all dependent on the physical therapist, chiropractor, and their business model. But we don't bill for a screen, we bill for an evaluation. Because that's what we're doing. Can it bill to be my insurance? Well, yes, of course. If the provider takes your insurance, absolutely they could bill it there. The only exception would be Medicare. Medicare mandates a prescription for intervention from a physical therapist or chiropractor. So if a Medicare patient wants to see me, they're allowed to see me without a script for one visit for an evaluation with no treatment, and Medicare will cover it. But if they need intervention, a script is required. So I would highly recommend to that population to go see their primary care doctor first, get a prescription, and then come see us, and then we can go from there. But that's kind of a statewide and national stipulation that we have to get through. But I have had those patients pay out of pocket a nominal fee for this, but I'd rather be honest with that and go from there. Before I take any questions, I do want to summarize and say, we do this for our eyes, we do this for our ears, we do this for our teeth, we do this for our medical screening, for gynecological issues, for prostate issues, we do this normally. Why are we not doing this for our physical health? Do all physical therapists do this? No. But I'm hoping that this will inspire everyone in this room and other healthcare people on this council that watch this video of implementing this in their practice, because it's a good way to engage with the community. It's a good service that we provide, and it's appropriate for assessing things, addressing things, and preventing things. So thank you guys for listening to my brief presentation, and I would love to take some questions from the Zoomers as well as in the room.
Yes, I have a question, and as you were talking about what it is that you do, I was thinking, let's say you meet someone that you can't help because it goes beyond your scope. Do you then work with other professionals that they might get additional help from if you can't provide? If that would as well, because I know that in my practice I sometimes have to do that.
Sure. In the state of Connecticut, we have what's called direct access, meaning we could see any patient for 6 visits or up to 30 days without a physician script. Also, because we are primary care providers, that's one of our roles, musculoskeletal primary care providers, is if I screen someone the first day and I see anything that's out of my scope of what I could do, they're getting referred out. So for example, if someone comes in with low back pain, they're over 55 years old with a gradual onset, they have no idea how it happened, they're getting sent to the primary care doctor because that is one red flag for possible cancer spread. Not saying they have it, but I need to rule that out before I go treatment. If I'm working with someone and they report any type of dizziness that I believe is not an orthopedic or vestibular-based issue, but might be a blood pressure, I'm going to send them out right away. So we are gatekeepers of musculoskeletal healthcare. So when someone comes to us and they're not the right fit, we refer out to whatever practitioner they need, which is more commonly the PCP, an orthopedist, possibly a chiropractor, nutritionist, or even, believe it or not, another physical therapist that might be more suited to treat that patient. For example, let's go with women's health issues. I treat a lot of pelvic pain and women's health issues. But if I believe anyone needs a little bit more of an in-depth exam that I'm not trained in, I have someone that I know in Trumbull that I refer to right away. So I hope that answers your question.
Yes, absolutely. Thank you. That was one of my questions. Thank you.
Twofer. I got a twofer on that.
Yeah, two for what?
Jay?
Yes.
Yeah, Dennis Blair. You talked before about the hunched over posture that so many people have looking at their computer screen, and the neck is forward. And there's inexpensive solutions to that, such as vertical mouse. Well, I found something that's cheap. It's free. I put 2 thick books underneath my monitor and now I'm looking straight at it. And honest to God, that forces you to sit vertical, straight up and down. And what a difference it made in just a week. My neck isn't bothering me now.
Thank you, Dennis. We'll call that the Boleria, right?
Yeah.
The 2 texts. But, strategies like that are so simple yet so effective. And, not everyone thinks that way. But I'm great that you brought that up. And the 2 textbooks underneath the monitor, or even a pillow behind your low back, or even getting up every hour can be a simple strategy to help decrease pain. Not cure, but at least alleviate some pain in there. Thank you for sharing.
Yep.
I never ever would have thought to do this until you just explained that. So yes, we do go to all of our other preventative things if we're doing the right thing. And your simple things that you just told us, obviously I know I have aches and pains. I know I have old injuries in my back and things like that, but you just had to stand on one leg. I'm right-handed. I feel like my right side is stronger than my left. And it wasn't when I did that. I could tell, and I'm like, wow, why am I having so much trouble keeping myself on my right? I do have a torn PCL in my right knee and meniscus. So I'm assuming that that's why I'm wobbling more, but I didn't even think about it. And I wrote it down. Why would it be one leg versus the other? And then as you talked about the ACLs and stuff. But that's interesting because at times I do lose my balance, now realizing that my right leg is probably weaker and that's why.
And one other area could be habitual, like your habits.
Yep.
For example, what side you carry your pocketbook. If you have a young child, what side you carry your child. When you stand, are you Shakira hip swinger to one side or the other side as well too?
Yeah.
When you're having conversations, are you looking straight at someone or are you always kind of turning to the side? There's so many small things that we can pick up on. And what we're doing is not rocket science. Real, believe it or not, it's not nothing crazy that we're doing. It's a simple screen. Everyone has their own style of how they do it. And Dennis on his talk last month was excellent. We talked about, food and exercise and everything else. And, we wish we could change the world in one day. And that's why I wanted to say that not everyone does this and not everyone is going to do this. But at least if I can start getting the word out a little bit more about some things that we could do, maybe we'll make small changes that may lead to bigger changes. So,
Dr. J, is there any connection between the hydration and cramps? I'm a runner, and I will get, sometimes a little night. Is there any connection at all with hydration? Just hydrate.
I like to say that there's a direct connection, but so it would, besides runners, just cramping, it could be how much water you're taking in, which the recommended is about 8 glasses of water a day for every cup of coffee you have. And I don't mean cup of coffee. For 1 cup of coffee, that's -1 water. So you want to net at least 8 glasses of water. The more that you exert during the day, the more water you need. The second part is kind of electrolytes. What is your diet like and what electrolyte imbalances are going on? Some easy ones are magnesium and potassium. Salt intake, you can mitigate that as well. The other thing also is a history of a lumbar issue. If you have any disc issues or degeneration in your back, that's going to cause a little bit more tension on the nerves, which is going to put the muscles at a little high alert and result in increased risk for cramping. And the third thing is recovery. Recovery is maybe after you work out, the muscle's in a state of readiness. And when the muscle's constantly ready to go, just being in an elongated position as you're sleeping can lead to cramping as well. So to give you the long-winded answer, yes, water, yes, electrolytes, always look at the back, muscle length and strength and recovery is a big way to go.
And how do you deal with it?
How do you deal with that?
Scream
how do you-
bloody murder.
Yeah, no, well, you scream right, but you stretch it.
Well, you could stretch it or strengthen it. So for example, one of the most there's people that have always reported tight hamstrings for decades and they stretch it. They do all these different stretches and it never gets looser. Well, it probably doesn't get any looser because it's actually a weak muscle that's always in a state of protection. So it's appeared as a tight muscle. So we have to kind of convince our clients and patients that the stretching you're doing isn't wrong, but it's not enough. So we need to implement some strengthening to the muscles to build up the energy reserve to tolerate the load so that they don't protect after a task. But my questions to you would be, how much water are you drinking on the days you run? What does your diet look like on the days you run? And what do you do after you run? Other things, what does your workouts look like besides running? Are you doing a little strengthening and stretching? And then sometimes the real answer to them is, I don't know. And I have to be honest, we don't know everything. And we don't have all the solutions.
You mentioned magnesium and something else when you said about electrolytes. What was that? I didn't grab it.
Well, there's calcium as well.
Calcium, okay.
Calcium, magnesium, potassium is another one as well. Sodium, they all go into muscle contraction and can be a precursor for cramping or not.
Okay.
And that's something that we don't test for. We just ask general dietary questions. If we believe that the cramping is a little bit more than we could go into, we'll have you contact your primary care doctor, or if you see a alternative medicine doctor, we'll have them test your blood, see if there's any values that are off. But a physical therapist can only coach on nutrition. We cannot prescribe or come up with diet plans. Even with certifications, you have to be licensed to do it.
Yeah, you have to work in conjunction with
Yes.
other professionals. Absolutely. Yeah. Thank you.
Mark Figler put into the chat pickle juice.
Ah, that's good. Yeah,
I heard
absolutely.
mustard,
Yeah.
Pickle juice?
if you're having a cramp in your leg.
Oh, is that
You
right?
drink
Oh, I
pickle
have to write
juice.
that down.
Yeah.
Or a
Hot dog
spoonful
water.
of yellow
Yeah.
mustard.
For cramp, that's a new one for me.
It's true.
I don't know, oh my goodness, you know, sometimes you don't know what to do.
Well, you can't
I
move to go
just-
get
I
pickle juice,
just,
so
I
forget
just
it.
drink my water.
When those cramps hit,
Yeah,
you're even
that's
sad.
And you know what? I'm gonna start a trend. Everyone should have a mini fridge with dill pickle juice. That's my new promotion.
Now, my question about pickle juice, why pickle juice? There must be something in it. I mean,
Um,
what
The
is it?
salt in pickle juice. I'm about to misspeak. It
Okay,
has to do with the salt content, but
Okay.
I don't have a great answer for you. I don't want to try to give you a made up better answer, but I know it has to do with the salt of it.
okay.
but I
just
could
wanna
definitely
write
email the
something.
group
I'll
and
look
look
it
at
up.
the third
I'm just gonna have to look this up.
Yeah.
'Cause I remember when I was young, I used to love pickles and I used to love the juice. I don't do that right now, but, so this is surprising.
It's basically to restore homeostasis in the salt content from like blood and, well, I don't want to go too deep or I'm gonna dig myself a hole.
Yeah, you don't
It does
have
say that
to.
there's no scientific information,
Okay.
however, runners swear by it.
Okay,
And it contains salt and vinegar, which may help
Okay,
replenish your
that's what I-
electrolytes.
okay, that
So-
was.
Fair?
And we just talked about electrolytes, and with that,
Coconut milk
Okay.
is good, all good around workouts.
Thank you, Mark.
Thanks, Mark.
But he also said it was too bad that the pickle juice is so gross.
Ah,
It's a what?
It's so gross.
Oh, I think. I'm gonna reconsider now. Wow, that is so interesting.
any other questions or comments?
So say you don't have as great mobility, do you actually treat with stretching and stuff like that
That day or in general?
in general?
So the answer is whatever the patient wants. So if they're coming in to see you for this, they're usually they want a, is everything okay confirmation? Or what do I need to do? So that day, it's kind of, well, that day, yes. You don't usually go to your doctor with an upper respiratory infection and then they say, come back in a week, we'll give you your medication then. So you gotta give them something.
Right.
So usually I'll give them a couple stretches to work on. And my comment to them is, what do you want to do? There's two options. We can schedule formal visits and work through this together, or I can provide you some guidance and some exercise on your own, and then you reach back to me if you need some. So I kind of leave it up to them. I don't be too pushy with this because it's not like they're in dire pain. And they'll try out at home, and if it works, great. Usually they'll give you a text or a call saying, hey, thank you so much, I feel great. Or they'll say, hey, I think I need a little more. Then I'll work with them. And again, if they're not progressing immediately, it's a referral to an orthopedist. If they are progressing, once we hit that 6 visit mark, you got to have that conversation with, hey, we're reaching our threshold for direct access. If we need to continue, we need a referral, which could be from your primary, an orthopedist, or a local physician. So it's just having an open dialogue, what the needs are for the patient, what they're looking for, to provide.
Hey, Jay,
Hey,
Dennis, there are times I'm working out in the yard too much in the summertime without hydrating enough. Here's the wellness guy getting himself screwed up and not enough water. But what I've done is I wake up at 2, 3 in the morning with cramps in calves or thighs and hamstrings, and it's a hell of a way to wake up. I mean, it's so damn painful. I've tried everything for that. Finally, I decided, well, what do I know about nutrition? Well, magnesium. So I, I get up and I hobble over to my nutrient stash and I take a magnesium pill and 5 to 10 minutes later, boom, it's gone. It's absolutely, now, will that work for everybody? I don't know, but it works magic for me.
That's great. I'm a little bit the opposite than you. I also get cramps when seasons change and I have to do yard work, hence raking leaves and shoveling snow. So I'm a right-hand dominant kind of raker and a shoveler. So I'm always grabbing the snow and throwing it to my right.
Yep.
And then I realized as I'm getting older, and I'm only 38, turning 39, that I need to start alternating going the opposite way too. Because
Yep.
I start getting kind of like a little bit of muscle spasms and cramp. It's not like I'm laid up, but I know I feel it the next day. So the kind of strategies that, or the questions that we ask is, how are you doing that? Are you alternating both sides? And we call it the vacuum cleaner phenomenon. If you're righty, you tend to vacuum in your right hand, going forward and back, which is repetitive left rotation. Well, you can only do that so many times before your back says that's enough. So again, it's giving people some guidance and advice, or hiring someone else to do it for you, but that gets very costly.
All right. Thanks.
Thanks for the magnesium comment. That makes perfect sense.
Let me just thank Dr. J. We had a wonderful golf outing, 25th anniversary with 25 foursomes. And Dr. J put together a 7-page dynamic stretching routine for our golfers and let them. And I joke they look like the June Taylor dancers out there, but you did a wonderful job with our golfers. It was a great way to start the day. So thanks so much
Thank you.
for your service.
Thank you. This was a great talk.
This was wonderful.
Appreciate it.
I had never even
Anytime.
thought